What is hypertension? Hypertension, commonly known as high blood pressure, is a medical condition characterized by a consistently elevated flow of blood against the walls of the arteries. It is typically defined as having a systolic blood pressure of 130 mm mercury or higher, or a diastolic blood pressure of 80 mm mercury or higher. This condition requires the heart to work harder than normal to circulate blood through the blood vessels. Prevalence. Hypertension is a prevalent condition both in the United States and globally. It is the most important preventable risk factor for premature death worldwide, increasing the risk of ischemic heart disease, strokes, peripheral vascular disease, and other cardiovascular problems. Causes and risk factors. The development of hypertension is influenced by both modifiable and non-modifiable factors. Understanding these factors is crucial for both prevention and management of the condition. There are two types of hypertension: primary and secondary hypertension. Primary is the most common type, accounting for about 90% of cases. It develops gradually over many years and is often linked to lifestyle factors and aging. Secondary type is caused by an underlying condition. Common causes include kidney disease, adrenal disorders, thyroid disorders, and congenital heart defects. Modifiable risk factors include dietary habits. Excessive salt intake is a major contributor to high blood pressure. Diets high in saturated fats and trans fats and low in fruits and vegetables also increase hypertension risks. Obesity. Being overweight or obese is strongly associated with increased blood pressure. Excess body weight increases the workload on the heart and can lead to increased blood pressure. Physical inactivity. Lack of regular physical activity can lead to weight gain and increased blood pressure. Regular exercise is crucial in managing and preventing hypertension. Alcohol consumption. Excessive alcohol intake can raise blood pressure to unhealthy levels. Tobacco use. Smoking and the use of tobacco products are known to elevate blood pressure and increase the risk of hypertension. Poor nutrition. Diets lacking in essential nutrients, particularly those low in potassium, can contribute to the development of high blood pressure. Stress. Chronic stress may contribute to high blood pressure, although the exact mechanisms are complex and multifactorial. Sleep patterns. Poor sleep quality, including conditions like sleep apnea, can contribute to high blood pressure. Non-modifiable risk factors include age. The risk of developing hypertension increases with age. As people age, the blood vessels naturally lose some of their elasticity, which can contribute to increased blood pressure. Genetic predisposition. Family history and genetic factors play a crucial role in the development of hypertension. Certain genetic disorders are associated with high blood pressure. Race or ethnicity. Certain ethnic groups, particularly Black individuals, are at a higher risk for hypertension. Gender. Men are generally at a higher risk of developing hypertension at a younger age compared to women, although the risk of women increases post-menopause. Pre-existing health conditions. Conditions such as diabetes, kidney disease, and certain adrenal and thyroid disorders can increase the risk of hypertension. High-risk individuals. Certain demographic groups and individuals with specific characteristics are at higher risk for developing hypertension. Older adults. The prevalence of uncontrolled hypertension is notably higher among individuals aged 60 years and older. Men. Generally, men have a higher prevalence of hypertension compared to women. In the 2017 to 2018 period, the prevalence was 51% among men and 39.7% among women. Black adults. Approximately 40.3% of black adults have high blood pressure, showing a higher prevalence compared to other racial and ethnic groups. Individuals with low socioeconomic status. People living in poverty are more likely to have uncontrolled hypertension. Socioeconomic factors play a significant role, with those in lower socioeconomic brackets experiencing higher rates of hypertension. Pregnant women. Pregnancy can increase the risk of developing hypertension. Individuals with coexisting health conditions. People with diabetes, kidney disease, adrenal and thyroid disorders, and sleep apnea are at increased risk of developing hypertension. Contributing behaviors. Several lifestyle choices and behaviors can contribute to the development or worsening of hypertension. High sodium intake. Consuming foods high in salt is a well-documented risk factor for hypertension. Low potassium intake. Potassium helps balance the amount of sodium in cells. A diet low in potassium can increase the risk of high blood pressure. Sedentary lifestyle. Little or no physical activity is associated with an increased risk of developing high blood pressure. Excessive alcohol consumption. Regular heavy alcohol use can raise blood pressure and contribute to hypertension. Tobacco use. Smoking and tobacco use can cause temporary increase in blood pressure and contribute to long-term risks. Poor stress management. Chronic stress can lead to behaviors such as overeating, poor diet choices, and increased alcohol consumption, which are risk factors for hypertension. Excessive caffeine consumption. While its long-term effects are still being studied, excessive caffeine intake can cause short-term spikes in blood pressure. Signs and symptoms. Hypertension is often referred to as the silent killer because it typically presents with few to no symptoms, making it difficult to detect without regular monitoring. However, when symptoms do occur, they can indicate dangerously high blood pressure levels. Silent symptoms. Most individuals with hypertension do not experience any noticeable symptoms. Symptoms of severe or acute hypertension. Persistent or severe headaches, shortness of breath, especially during the physical exhaustion, nosebleeds, although it is not common, vision problems including blurred vision, chest pain, pounding sensation in the ears, neck, or chest, fatigue, or confusion. Symptoms of hypertensive crisis. Severe headache with blurred vision and confusion, nausea and vomiting, severe anxiety, seizures in extreme cases. It's important to note that many of these symptoms only appear when blood pressure is dangerously high, emphasizing the importance of regular blood pressure monitoring. Complications. Untreated or poorly managed hypertension can lead to severe health complications affecting multiple organ systems. These complications can be categorized into short-term and long-term effects. Short-term complications. Hypertensive crisis. A severe increase in blood pressure that can lead to a stroke. Blood pressure readings over 180 to 120 mm mercury require immediate medical attention. Acute organ damage. In a hypertensive emergency, there can be marked elevation in blood pressure associated with signs of target organ damage, including pulmonary edema, acute kidney injury, and acute heart failure. Sexual dysfunction. Hypertension can lead to sexual dissatisfaction in both men and women due to the added stress on the heart and arteries, which affects blood flow. Long-term complications. Cardiovascular diseases. Heart attack and heart failure. High blood pressure can cause the arteries to harden and thicken, leading to a heart attack or heart failure. Stroke. Hypertension can cause strokes by blocking or bursting the arteries that supply blood and oxygen to the brain. Kidney damage. High blood pressure can damage the blood vessels in the kidneys, leading to kidney disease or kidney failure. Vision loss. Hypertension can cause damage to the blood vessels in the eyes, leading to conditions such as retinopathy. Metabolic syndrome. This cluster of conditions increase the risk of heart disease, stroke, and diabetes. Cognitive impairment. Chronic hypertension can lead to cognitive decline and increase the risk of dementia. Aneurysms. Increased blood pressure can cause blood vessels to weaken and bulge, forming an aneurysm, which can be life-threatening if ruptured. Peripheral artery disease. This condition occurs when narrowed arteries reduce blood flow to the limbs, which can be a result of long-term hypertension. Lifestyle modifications. Reducing blood pressure should begin with lifestyle modifications before resorting to medication. Lifestyle changes should be made for everyone, even for those who are not yet diagnosed with high blood pressure, as these changes can help prevent or delay the onset of hypertension. The following lifestyle changes are recommended. Weight loss. Maintain a body mass index BMI between 18.5 to 24.9 kg per meter square. Diet control. Increase intake of vegetables and fruits, especially those that are not overly sweet. Reduce the amount of fat in the diet, particularly saturated fats. Limit salt intake to no more than 6 grams per day. 1 teaspoon of salt weighs approximately 5 grams. Exercise. Regular aerobic exercise should be done. Activities such as brisk walking, running, swimming, or cycling are good options. Limit alcohol consumption. Reduce or avoid alcohol consumption, and excessive drinking can raise blood pressure. Quit smoking. Avoid smoking as it harms blood vessels and the heart, which can increase blood pressure. Manage stress. Stress increases blood pressure. Deep breathing exercises, meditation, yoga, and relaxation techniques can help reduce stress levels and blood pressure. Regular health checks and blood pressure measurements. Regular health checks and blood pressure measurements will help you know your accurate blood pressure readings and adjust your health care as needed. Exercise prescription for hypertension using FITT principle. So, I'll be talking about an exercise prescription for hypertension using the FITT principle. Frequency, intensity, time, and type. Research shows that a mix of aerobic and strengthening exercise is effective for managing blood pressure and improving heart health. Number 1, aerobic exercise. For frequency, aim to do aerobic exercise at least 5 days a week. This can be 150 minutes per week of moderate intensity exercise, such as brisk walking or light cycling, or 75 to 90 minutes per week of vigorous intensity exercise, like jogging or running. For intensity, moderate intensity activities should target 64 to 76% of your maximum heart rate, estimated as 220 minus your age, and fall within 3 to 6 METs. Vigorous activities, on the other hand, should reach 77 to 95% of your maximum heart rate at 6 plus METs. These aerobic or endurance activities work your heart and lungs, helping them pump oxygenated blood more efficiently to reduce blood pressure. Strengthening exercise. Now, for strengthening exercise, aim for at least 2 non-consecutive days per week. This could involve resistance training like weightlifting or using resistance bands, which helps reduce body fat, build lean muscle, and improve cholesterol. When combined with aerobic activity, this exercise mix can help raise HDL, which is the good cholesterol, and lower LDL, which is the bad cholesterol, both essential for heart health and managing blood pressure. In summary, to manage hypertension effectively, aim for 5 days of aerobic exercise per week at moderate or vigorous intensity, with strengthening exercise twice a week. This balanced approach improves cardiovascular health and helps control blood pressure. Precautions for exercise. Obtain medical clearance. Before starting any exercise program, consult your healthcare provider, especially if you have pre existing conditions like hypertension, heart disease, or diabetes. Incorporate warm up and cool down. Spend 5 to 10 minutes warming up to prepare your muscles and heart for activity. Cooling down helps your body return to its resting state gradually, preventing sudden blood pressure changes. Start with moderate intensity. Begin with low to moderate intensity activities like walking or cycling. Gradually increase duration and intensity to build endurance safely. Monitor your body signals. Pay attention to symptoms like dizziness, shortness of breath, or chest pain. Stop exercising immediately if these occur and seek medical advice if needed. Avoid overstraining. Refrain from activities that involve heavy lifting or holding your breath, as these can lead to dangerous spikes in blood pressure. Stay hydrated and rested. Ensure you drink enough water before, during, and after exercise. Avoid walking out if you are overly fatigued or dehydrated. Choose a comfortable environment. Exercise in moderate weather and well-ventilated areas to avoid additional stress on your cardiovascular system. Contraindications for exercise. Uncontrolled high blood pressure. If your blood pressure exceeds 180-110 mm mercury, engaging in exercise can pose serious health risks. Recent cardiac events. Avoid physical activity if you've had a recent heart attack, stroke, or cardiac surgery unless approved by your doctor. Severe heart or valve conditions. Conditions like severe aortic stenosis or unstable angina make exercise unsafe without close medical supervision. Irregular heart rhythms, arrhythmias. Uncontrolled arrhythmias may worsen during exercise and increase the risk of complications. Advanced retinopathy or eye disorders. Avoid exercises that involve heavy lifting or intense pressure changes, which can harm delicate blood vessels in the eyes. Orthostatic hypotension. Activities involving sudden changes in position should be avoided to prevent dizziness or fainting. Acute illness or fatigue. During episodes of fever, severe fatigue, or acute infections, rest is essential to aid recovery and prevent further strain on your body. By following these guidelines, you can exercise safely and effectively while minimizing potential risks.